Dr. Dunn has been really a very steady voice that I think people have appreciated throughout the state to not only just give us information, but also give us the context of what it's found. And so I appreciate her report that she's given today. And in that same vein, today I'd like to ask Dr. Dunn to come back out. What I've noticed is we've had a number of questions that keep coming up. And I'm not sure that we've answered the questions as diligently as maybe we need to do. We say it once and maybe only a few people hear it. But there's a number of questions I have here that I would like to ask Dr. Dunn, kind of under the heading of let's make sure that there's an understanding of what's taking place, what the truth is, that separate fact from fiction, and give us better context as far as where we're at. So Dr. Dunn, if you'll come forward here, I'll stand to the side and I'll ask you some questions. We'll slide back and forth. The first question I hear all the time is, Governor, this is really no different than the flu. It's the same thing. It's an overreaction the government is making and others in regards to COVID-19. So the question, Dr. Dunn, is what is the difference or the similarities between our traditional flu, and we have a flu season coming up, and the COVID-19 pandemic?
Yeah, so we know that COVID-19 is certainly more infectious and more deadly than the annual flu. Already to date, we've had twice as many hospitalizations and 5 times as many deaths due to COVID-19 compared to last year's flu season. There's also some key differences, right? Flu, we have a vaccine and we have known treatment with antivirals, and we don't have that information yet for COVID-19. There's just so much we don't know about the virus that causes COVID-19 that makes it more dangerous and unpredictable moving forward. So it's really important that we do everything we can to protect ourselves against flu moving forward, because we are going to enter flu season, and make sure we all get our flu shots so that we can continue to stay safe from all respiratory viruses and protect our healthcare capacity. So moving forward, we just know a lot more about flu. We've got a vaccine and we have treatment, and already COVID-19 has caused more hospitalizations and deaths this year alone.
Let me just follow up on that, Dr. Dunn. The concern I think many people have is the impact of the flu on us, or COVID-19, both, I guess. You mentioned it's more infectious, it's more deadly. I hear different reports. I see the mortality rate in Utah is at 0.7, less than 1%. Nationally, it's 3.5%. That's 35 times more deadly around the country than it is here in Utah. Talk to that issue compared to flu, which I've heard is 1/10 of 1%. Those that contract it die. We do have some advantages with a vaccine, which we don't have in COVID-19. But tell me exactly, and tell the public, how much more deadly is the COVID-19 than is the flu?
Yeah, so because COVID-19 is something we just identified in December of 2019, it's going to take the scientific community time to understand exactly how much more deadly it is than flu, because it's only been around for a few months. And so as this pandemic evolves and we get more information, we'll be able to more accurately say how deadly COVID-19 is. I think something to anchor to, though, is knowing that already in 5 months of COVID-19 in Utah, we've had 5 times as many deaths due to COVID-19 compared to flu season last year, which is an 8-month season. So it has already claimed more lives than flu.
We've talked about case counts. That's been a topic, and we see that as kind of a headline on the news every day about how many the case count numbers are. I'd like you to tell me what you believe is the most important data. Case counts may be one, but is there other things? What's the most important data that the state uses for making our decisions, and what should the public use? What should they be listening for that's available to them online, or what they say here in our press conferences? What's the most important data points?
Sure. So from a public health response perspective, we look at our data to identify which populations are carrying the biggest burden of COVID-19 and what interventions would most help those populations. So we're looking at infectiousness, death toll, but also access to testing to make sure that we have as much prevention measures in place as we can to protect those at highest risk for severe disease due to COVID-19. On an individual basis, definitely the information on the coronavirus.utah.gov website is really important for you to understand kind of how the spread is going in Utah and the impact that our own individual actions can have. I mean, we know that since individuals have started wearing face coverings, for example, more in the past month, we've seen a drastic decrease in cases. So we know that the individual actions we all take can help populations as a whole be healthier throughout this pandemic.
Again, along that same vein, we hear about case numbers, we hear about infection rates, we hear about transmission rates. Can you explain the difference between those three?
So the case numbers that we report from a health department on a daily basis are just the actual numbers of individuals getting infected. We also look at rates by geographic area so that it takes into account the underlying population. So the denominator of Salt Lake County, for example, compared to Iron County. Very different populations, and it allows us to understand if those populations were the same, is the infection rate the same so that we can identify the true burden of disease. And then we also talk about transmission rate, and that's how likely one individual who's sick with COVID-19 is to infect another individual. And the measures that decrease that transmission rate before we have a vaccine are going to include wearing a face covering, staying home when you're ill, and practicing physical distancing. And right now our transmission rate in Utah is estimated to be below 1. So that means that every individual who has COVID-19 is spreading it to less than one other individual, and that's contributing to our decline in cases.
I follow the transmission rate. I think that's really a key issue for us, and to find that we're down below 1 now is good news. That means our numbers will continue to slow down. Another question I get all the time is, how do we in fact determine whether somebody dies from COVID-19? And there's confusion about there. There's confusion I've heard in different areas of, well, hospitals are inclined to make it a COVID-19 death, even if it's marginal, because they get paid more money if it's a COVID-19 death. So how do we in fact determine if somebody died based on a COVID-19 infection?
So we at the health department are notified of every individual who has COVID-19 and then passes away. We work with the clinicians and our medical examiner to determine the cause of death. So just because someone has COVID-19 when they pass away does not mean that they will be counted as a death due to COVID-19. We actually investigate those cases to make sure that the cause of death is related to COVID-19, so that if that individual had not had COVID-19, they would not have passed away. So all of our deaths are specifically due to COVID-19, and I'm very confident that we're capturing the deaths accurately.
We've heard a lot of talk about mask wearing, and certainly in Salt Lake County, they've touted the fact that their rates have gone down, their case numbers have gone down because of the use of the mask. The question is, people ask, is it really the Salt Lake County has gone down, or they just plateaued, and has the rest of the state increased? So that it looks like Salt Lake County has a smaller percentage, even though they're a third of the population. We know that they have a higher than about 57% death rate. And so how do those juxtapose? And is Salt Lake County getting better, or is the rest of the state just getting worse?
That's a really good point. We know that Salt Lake County is seeing a true decrease in cases. Ever since, about 2 weeks after the mask mandate went into place, we've seen a really sharp decline, and that's also contributing to our overall statewide decline in cases. For most of the pandemic, Salt Lake County had contributed to over 50% of our cases statewide, and now they're at about 40 to 45% of our cases statewide. So they are dropping quicker than our surrounding jurisdictions across the state. However, the good news is that right now, all of our jurisdictions are seeing a decrease. So we're going in the right direction statewide, but Salt Lake County specifically is carrying a lot of that burden in terms of decreasing really quickly and allowing us to see the trend go lower statewide as well.
Thank you. I have two more questions. we have on our webpage, and information that comes out says that 68% of the people who've contracted COVID-19 have recovered. And so we have people think, well, we're only getting about 2/3 of the people recovering from the virus, and yet our mortality rate is at 0.7. Can you explain what the truth is about the recovery rate of the people of Utah going through this process now these last 5 months?
So recovery rate is something that's, not well understood across the world in relationship to this pandemic. So we are using a very crude definition of, if you've been identified with COVID-19 and you haven't passed away within 3 weeks, we're considering that recovered, and we recognize that that's not true recovery. We know now that individuals, even if you haven't been hospitalized, can take several weeks to a month to actually fully recover, and we're learning more and more about the long-term effects of COVID-19. So recovery is one way that we are tracking people who are potentially still infectious and still out there in the community with COVID-19, recognizing that there are a lot of limitations to that number. Of course, as we're progressing through this pandemic, we have more cases, coming in over the past weeks and months than we did at the beginning of the pandemic. And so our recovery rate will lag as well, because we have more individuals being diagnosed every day with COVID-19, and it has to be 3 weeks before they're considered recovered by our metric right now.
I guess, Dr. Dunn, it depends a little bit on how we define recovery. If recovery is defined as you didn't die, then 99% of the people that get it are recovering in Utah. But we also know that there are some residual impacts and some concerns we don't have. We have some uncertainties. What are some of those uncertainties that people are looking at with the contract COVID-19 in a longer term period?
Yeah, again, this is something that we are looking at nationally, and scientists are trying to figure out worldwide, what does that long-term effect of COVID-19 look like? We only have a few months here in Utah to really try to understand that. And we know that there are some individuals that have problems breathing and engaging in exercise and activity that they engaged in prior to COVID-19 for some weeks after having the illness. So that is an evolving aspect of this pandemic, and something that we're all trying to really understand completely, so we can identify who's actually recovered.
Thank you. And the last question is one that we've started in the very beginning. We've talked about the importance of what we do as a community, as a state, to make sure we don't overwhelm the medical system, the healthcare system. And so talk to us about hospitalization availability, rooms that are available. I know we have about 4,200 hospital rooms in the state of Utah. How many are being utilized? ICU beds. What are we doing? Are we in danger of overwhelming the healthcare system, the hospitalization? Help us understand that a little better.
Yeah, so we work very closely with all of our healthcare systems to identify their capacity to take care of COVID and non-COVID patients. And that's something that we really need to have our finger on the pulse of as we enter flu season, knowing that we will have more individuals being hospitalized due to flu on top of COVID. So currently we look at number of hospital beds available, so non-ICU and ICU beds, and we look at COVID patients and non-COVID patients taking up those beds. For hospitalizations overall, so non-ICU beds, we have robust capacity there. We haven't really gotten near overwhelming our general hospital beds. It's the ICU beds that are, more limited capacity. We have, somewhere around between 500 and 600 ICU beds available in the state of Utah, and we look at, are they adequately staffed? Can they provide high level of care for COVID patients? And that's something that we really need to protect moving forward as we move into especially flu season. So that's why it's so important that everybody get their flu vaccine when it becomes available in September.
Thank you, Dr. Dunn. We appreciate those frequently asked questions and your answers. Help us understand better. Don't go away. We'll have probably some Q&A here a little later too, and we might have some more questions for you.